People living with hepatitis B and C, and 81% of low-income country governments have not funded any awareness work, and 85% have not acted to reduce this stigma. So we do need a lot of work. Hopefully in September when Bruce, Sue, and Harry goes back to legislative, please keep that hype on and create awareness inside the legislative as well. Our next guest, Dr. John Farley, who is the Hep C specialist of BC. He's done a lot of work, has tremendous respect in the medical industry. I just want to invite him to say a few words. Dr. Farley.
Thank you, Monica. And I would also like to echo the sentiments of others earlier who must commend you on the tremendous amount of work you're doing in the community, highlighting this very important public health issue. I practice in Vancouver here. I've got an office in Abbotsford as well. I work in the corrections institution, and I can tell you that I have first-hand experience of some of the problems that Emily Baines was talking about, and issues that I think we are not prioritizing. We have a significant public health problem. We've heard that over 260,000 Canadians have chronic hepatitis C virus infection. 1 in 12 has hepatitis B. We have a public health problem where about 30,000 people are walking around with hepatitis, and about 2/3 of them don't even know that they have it. We have, over the last 10 years, had a very good treatment regimen for addressing this important public health problem, yet less than 1/10 of those who should be treated are even considered for treatment. I've heard, and I'm so very happy that last year I was here, there were no MLAs, now we have some MLAs, and I think that going beyond the recognition would be one of the challenges, Mr. Ralston, and I think that we should use today's day to propel. One of the challenging issues we have is getting people treated, not because they do not want to be treated, but because we have significant bureaucratic nightmares in terms of getting people who should be treated. We have about 1/3 of people in my practice and in many practices who are eligible for treatment, but because of some artificial guidelines that are set by who I don't know, and some transparency that we don't know about, a lack of transparency, I should say, that we don't know about who makes these decisions, about 1/3 of BC residents are denied treatment. Needless to say, when we see them, we see the end product of this lack of treatment, which could be end-stage liver disease, cirrhosis, as well as hepatocellular carcinoma. Hardly a month goes by, a week goes by without my seeing the effect of this lack. Now that I've got the MLA's attention, the truck isn't going to silence me. Yeah. Okay. Anyhow, I would like to go
the famous garbage man.
I'd like to draw your attention to a petition that we have been forced to generate. Unfortunately, I use the word compel. This has been going around for over a year. Basically, the petition states that 1 in 12 Canadians live with either hepatitis B or C, that approximately 5,000 die each year from this condition. 1,000 people will die each year from hepatitis, and we now have pharmacare eligibility criteria that makes absolutely no sense, and whoever in the committee and how they've chosen, I don't know, but the long and short of it is that because of this, 1/3 of people who are eligible, who should be treated, are deemed ineligible for treatment. We're asking folks to consider, if you're so inclined, to sign this petition so that we can take it to our legislature and we can now put our money, as we say, where our mouths are, and go beyond recognition to start treating people who can and should be treated because we have very good treatment available. I'll stop at this point and hope that this good work that's going on here will be propelled, and I certainly hope that I'll be hearing more from our MLAs that next year when we come here, we're no longer going to have an impediment called normal ALT, why a third of our BC population cannot be treated. Thank you very much.